Hey everyone, it's Allison here. I wanted to do a quick post on dental hygiene on a high carbohydrate diet. Let me give you a little bit of my history, a little bit of my trauma that I went through, and what I'm doing to overcome. So my history is I was on the standard American diet, ate 3 square meals a day, a little bit of snacking, but not really until I was like in a teenager ages. Got my teeth cleaned every 6 months with fluoride treatments and had beautiful teeth. Was blessed, right? So then, September 2007, I transitioned to a high carbohydrate, low fat, raw vegan diet, which pretty much means you get most of your calories from fruit, raw, unprocessed fruit, and you have, 2 heads of lettuce a day. It's pretty much the way I was doing it. There's tons of different ways to do it. That's how I was doing it. Anyhow, but that also meant that I wasn't just having 3 square meals a day. I was pretty much having food all day long because bite for bite, whole raw foods are not as calorically dense as processed foods. So I had to consume a lot more volume, which meant that I, instead of just sitting down and having like this huge pile of food, I just couldn't do it. My stomach wouldn't stretch that much and I didn't want to. So I would just spurt it out over the day. So anyhow, and I also learned at that time the dangers of fluoride and what fluoride really is. And so in September of 2007, I quit using fluoride. I started eating a whole bunch of carbohydrates in the form of fruits. And so that fruit sugar was on my teeth all the time because I also was not just eating 3 square meals a day. I was eating all day long and I just loved it. And whenever I wanted to brush my teeth, I would just brush my teeth. If I thought, I haven't brushed in a while or something, or I got 2 sweaters, that's for you, Amy Monroe, I would brush my teeth whenever. Well, after I was raw vegan for about 5 years, maybe even 4.5, I started noticing that, this is really gross, but when I would floss, it smelled weird. Like the floss would come out smelling weird, and I was like, eh. And I was still going to the dentist every 6 months or whatever, but they never said anything was wrong. Well, I showed them, I told them about it, and sure enough, ends up big cavity, deep, big cavities. I'm like, how did that happen over, how did you guys miss that or whatever? Anyhow, so that was my history. So now my trauma is that I pretty much had to have huge cavities drilled out of my teeth, so close to my pulp that they actually had to put a pulp cap on, just to make sure that my tooth wouldn't reject the filling that they were putting in. And I got all mercury removed and I used composite for these new ones. But anyhow, so I had all that dental work done. And then I'm like, okay, well, what changes do I make? And of course, I'm like so upset because this is kind of like a social note, but my whole identity had been formed around like my eating style and stuff like that. So unfortunately, there were a lot of people in the movement that started the same time I did, that started having dental issues the same time I did. So we kind of all banded together and really talked a lot and helped each other, and everyone kind of branched off and was doing their own different kind of thing. Honestly, like, I just value all their opinions and time with me, and we really helped each other through it all. But now I'm just feeling like really good and settled into my new routine. And so I really wanted to share that with you and the community because I feel like it's very important, because physically you feel amazing when you're low-fat raw vegan. I mean, it's just no doubt. Like, there's no other feeling that you'll have like that. But it's just not good for your teeth. I mean, I don't know how else to put it. So, and if you don't believe me, look at all of the raw vegan leaders. Look at their teeth. That's all I got to say. Except for a few, but then they have little secrets. So you got to ask them what their secrets are. Anyhow, so I just wanted to give a little breakdown to what I'm doing. So my first thing is I finally broke down and went back to fluoride. I was like, I'm not willing to give up the fruit, but I will go on the fluoride. So it's kind of like, So I chose fluoride. So what I have done is I've gotten a prescription for this Colgate Prevident. This is, prescription only strength. I think it's 1.1% sodium fluoride. So it's pretty high. I use this one time at night, this stuff. And you want to make sure that you get the 18-ounce bottle, because if you get the larger ounce, I think it's like 33 ounce, the concentration is less. So the smaller bottles are better. And your dentist should have coupons for these kind of things. The other thing that I use is, you don't have to use this brand, but the main thing is for the dental floss, you want to use a dental tape, which is much better for your gums than a round thing. The other thing is I use an oral irrigator. This is a really cool tool. Let's see how I get it in the picture. It hooks under your sink. So you put it on under your sink, and then you turn your water on, and I don't know if I can show you. You can see this. Can you see that? So anyhow, this is an oral irrigator that I use after showers mainly, because the water has to be warm, and in our house I don't want to waste water just to get the water warm to use it. So I use that after showers and just kind of let it go through, because it really massages the gums. Now, as of now, I'm using just a regular toothbrush, but I'm actually switching to Sonicare. I'm doing all the research now. I think I'm going to get the platinum one, which makes it has some sensor on it that I think it vibrates or beeps if you're pressing too hard on it. So that, and then here's something that I do every so often, but honestly not too much lately. I just take coconut oil and do oil pulling. So if you've ever heard of that, it's essentially like swishing your mouth with coconut oil. So those are the physical things that I do. Now, as far as like lifestyle wise, I try to eat just 3 square meals again, because apparently after you eat anything sugar that has sugar in it, even if it's fruit, natural sugar, not like the white powdery stuff, your teeth have like a 20-minute acid attack on them. So if you can decrease the amount of acid attacks that your teeth have on them throughout the day, you're going to help your enamel much more. You never really, well, I don't know if this is true. I'm not even going to say that. So yes, so you want to have, try to have the smallest amount of, well, you can have a bunch of food, obviously, but, try to have as fewer meals as you can, because you don't want to, like how I was doing before, I was just eating all day long. That's just not good, because my teeth were constantly bombarded with acid, and that's not good. So, and the other big thing is, do not brush right after you eat. Wait that good 20 minutes after the acid attack is over, because your teeth are really soft and vulnerable during that acid attack right after you eat. So if you are going to brush your teeth after you eat, wait at least like 20 minutes. So yeah, I think that's all I really wanted to say. I'm trying to say, like, the transparency is definitely going away, and obviously, I just had my checkup and everything is good, so I'm excited. Anyhow, I hope this video helps you prevent things. I don't want anyone to go through the trauma I did, because it is not fun. So anyhow, my stage right now is that I'm doing all this work to rebuild it up, and I'm hoping I don't have to keep doing this the rest of my life, but anyhow, we'll see what happens. The main thing is that I just want to get back to my 3 square meals, and then I still want to be high carbs, because that I feel best that way, and I train best that way. So anyhow, that's all I want to share. Thanks. Have a great night.